So next up, we have Dr. Lukas Jasiūnas from Healthier Hens, and he's presenting on behalf of his team. His talk is Building Animal Welfare Knowledge and Capacity Through Veterinary Training on Egg-Laying Hen Welfare in Kenya. Thank you very much, Lukas.
Thanks so much. Thanks so much also for the great talk before. I can definitely, those are way too clever and very good at remembering where all the treats are. But today, I will quickly go through some of the work we've been doing to raise the welfare awareness and knowledge among veterinary professionals in Kenya, specifically when it relates to hen welfare. A bit about ourselves to start. We are a nonprofit funded in 2021 with the main core objective of identifying effective ways to improve the well-being of hens. And our initial focus was actually the widespread and neglected issue of poor bone health. So this typically surfaces as, for example, keel bone fractures, a leading cause of pain in cage-free settings, but quite prevalent across all housing systems. And I definitely recommend you to stick around for the next talk. Bas will definitely mention why the first priority is get cages in the first place. We chose to pilot Kenya, trying to look at how the hens fare in cage-free settings there and what can be done for, let's say, to sustain their welfare in these less intensive systems. And of course, along the way, we do have to understand key stakeholder groups, and vet professionals are among them. So day 2 dating in Kenya, we collaborated with the local NGOs. As you've heard from Dennis yesterday, from the African Network for Animal Welfare, about the great work that they do. Also, University of Nairobi, who are the leading educator in the field of animal welfare in the country. And our goal was to really enhance the understanding of egg-laying hen welfare and the specifics therewith, and of course, bring this novel, let's say, topic of keel bone damage into the awareness of the vet professional. In the end, we had 8 properly through activity within the farming community. So we want to really get those practicing professionals on board. And the training was split between theory and practice that I'll explain a bit more now. So the diverse modules cover topics from, basic animal welfare principles, such as the 5 freedoms, and to hands-on keel bone damage assessment techniques and other welfare indicators. Besides the lectures, we'll add laboratory sessions and some on-farm assessment exercises at the very end of the workshop. And of course, we did want to understand the knowledge gaps existent and to gauge which of these aspects of the training are most comprehensive, which are most, let's say, conducive to knowledge retention. A bit about the participants. So something that did surprise some of us coming from the global north was that the applicants were alienated, which is unusual, let's say, in Europe or the US. As mentioned, we focused on actively practicing professionals. So the age bracket was mostly as, a bit of experience. They had a bit of experience under their belts. And in terms of their, let's say, professional background, we mainly had professionals with veterinary degrees or holding master degrees. So in terms of evaluating the workshop or looking at how the knowledge developed throughout the training, we collected data before the workshop, right after, and then 2 months afterwards to see at impact. Additionally, we also had a short key informant interview with a couple of participants 6 weeks after the workshop. I'll quickly go through a couple of interesting data points. The first one, for example, is kind of basic level of general animal welfare knowledge. So, the 5 freedoms were mentioned quite a lot. So in assessing them, for example, before the training, we saw that quite a few participants didn't really, couldn't really place the freedoms and really identify them correctly. But happily, after even this short training, we saw that, their knowledge was refreshed and sustained, at least as far as these basic welfare concerns go. Another relevant thing, given that these were actively practicing professionals, was that half of them didn't really know about the relevant laws in Kenya that protect farm animals, which of course surprised, to be honest. It wasn't a big part of the curriculum, but so we didn't expect a major increase, but happily through the discussions and panel discussions during the workshop, this knowledge was a bit increased, but still, we believe this is quite a significant gap that should be addressed. Moving on to the keel bones and keel bone fractures, a third of the applicants said that they have observed fractures on farms before, but after the 2-day training, it's actually the number went up to roughly 2/3, meaning that either the participants didn't realize that what they had observed on the hens were fractures, or perhaps there was a bit of bias involved, which I'll touch upon a bit later as well. So when we talk about keel bone fractures and keel bone damage, I just put a couple of graphs here so that everyone's kind of roughly familiar with what we're talking about. So typically from healthy to deviated, and then various degrees of fractures, right? It could be single fractures, could be old, new fractures, could be multiple fractures. So one thing that I want to kind of highlight was that for some specific keel bones, after the training, we did have a significant consensus. The participants, like you can see keel bone 3, all of the participants correctly assessed it, keel bone 5 as well, whereas in the beginning, half of the people who could identify the healthy bones. But there was a bit of, let's say, confusion remaining, especially in the case of for example, keel bone 1, where only 8% identified that it's in fact a healthy bone. This is actually a number that decreased when compared to the pre-workshop figures, meaning that at these kind of low intensity, things, there's either still confusion on what is a fracture or damage, or perhaps, at least we believe, there might be a bit of positive bias because if you spend 2 days looking at fractures and searching for fractures, there might be a bit of a tendency to find fractures. That's at least something that we're a bit wary of, and that's also why through the training we went through several different types of assessments, patients, let's say the easy one, but also looking at the bones more quickly and so on. So interesting findings in any case that also point towards the need for more practice and training. It's hard to read, but hopefully guide you through and highlight a couple of things. These are the evaluations of the different modules that were part of the training, and I just wanted to point out that in general, good. There were some recommendations for further improvements, but the that really made a lot of impact for the participants was so the assessment of different welfare indicators in terms of practical skills, so the on-farm assessment and the lab assessment, and also the interlinkages between human health, animal health, and the well-being and welfare of the two groups. But welfare concept was something that's relatively new and very interesting for the participants. After that, there was quite a lot of interest as well in the other indices and other, let's say, metrics of welfare, right, going on injuries and disease. So understanding behavior better, stress, and also the function and role of enrichment in generally did see that there was a consistent increase in absorption and knowledge retention, but as mentioned, there were a couple of initial knowledge gaps that perhaps we didn't expect as much. So, things like basic welfare, the legislative landscape, etc. So it seems like These topics are not generally discussed enough and should be more in the curricula. Also, some interesting topics came up where practices such as, the use of hormone stimulants, debeaking or declawing were still quite often regarded as good farming management practices, which was surprising as well. Because this is let's say a veterinary professional cohort, so we didn't expect that much. There is shown in the assessment definitely supports the need for continuous opportunities, and that's something that obviously is not readily available, right? There is no, let's say, incentive for these farmers to really go out there and improve or at least assess welfare on farms. Showed and the modules were insightful. They did want to learn much more about several topics, such as the same keel bone damage topic, the link between welfare and productivity, human handling either during vaccination or transportation, and the different welfare indicators too. We got some feedback on how to improve such training. One of them was about time, during the week or month, extending the duration possibly, having more hands-on sessions, and then finally improving accessibility so that more of their colleagues could attend such workshops. And finally, of course, this was something that was emphasized quite a lot, is that to kind of implement these new skills and knowledge learned, there is a need for additional support, such as access to materials, whether for demonstration or self-learning, development and practicing, and of course improving those farmer extension services. There is an incentive and an opportunity to go out and practice this on the farms. And small recommendations from what we've observed during this small exercise, that there was quite a lot of topic dependent variation among the degrees of uptake and retention. So there is a need for allocating resources before any training to really understand what's missing and what's let's say perhaps very specific to the given geography. And of course, supporting the creation of those context-specific learning materials that could, either debunk these prevalent myths or simply challenge some of those practices that are really outdated and detrimental to hen welfare. We would suggest that perhaps extending the training to more days could be effective, but it could be also addressed by follow-up activities instead of just one longer training. So in general, that's all for the time being that I had to share. But of course, we do have a full publicly available report about this training, so I invite you to take a look. There's much more that we discuss over there. I'd also really like to take a couple of seconds to thank all of the amazing instructors we had the pleasure to have for this training. They are the ones who actually made it worthwhile and really interesting for the participants. And finally, of course, I do want to highlight that later today, Carolyn will be talking about, I'm sure, many great other things that can be done within education. We definitely look a lot at WTS and see how they make education more accessible and effective. So stick around for that too. Thank you so much.
Thank you very much, Lucas. That was a really great talk, and it was great to hear that the training did improve keel bone fracture identification. I'm personally very interested in veterinary education and educating stakeholders in welfare. So I have a kind of two-in-one question for you. Firstly, did you find any particular techniques useful to engage your learners? And secondly, have you been soliciting feedback from your learners on how they're using what they've learned to have positive impacts in the field? And do you have plans to measure that?
Yeah, so on the first point on engagement, actually it was one of our collaborators feedback to us that he was surprised at the high level of engagement. They come from, their experience in Europe, where these kind of continuous development exercises are typically formalities, but he was surprised by the engagement. during the course, we tried to facilitate it through, for example, discussions. We had like a panel where we would have more different stakeholders, not just like a one-way lecture kind of thing. And then those hands-on exercises and practice was really what got people involved. In the specific context of welfare assessment, of course, it really helped that it's kind of like a group activity, right? You want to match the participants so that they share, they have like this peer-to-peer exchange, not only from the instructor. So there were a couple of things, and we're really happy with the engagement. With regards to your second question, yes, we did ask about implementation. Obviously, it's self-reported, so we're not like extremely happy about it, but at least from the key informant interviews, the two people that we talked to quite extensively about it, they definitely said that it's very helpful. They feel much more confident in how they can help the farmers, but they did emphasize once again that, besides us coming there and helping them do these assessments on the farm, there's little incentive for them to really do it. There's no like certification schemes or anything like that that would have them go out and really check these things. So that's something that still needs to be developed in the region, I believe. But yeah, they definitely wanted to use those skills, which I think is a great first step.
That's great. Thank you so much. If anyone has any further questions, please do post them in the chat and we can continue the discussion in the chat. I'm now going to hand over to Tamara for our next talk.